of secret line, like leaves we soar so high. Beneath the moonlight, soft touch your hand in mine, gets me every time.
Isn't it ironic that oftentimes when we think of and talk about anything to do with beauty and enhancing external bodily beauty, there is a section of society and a large number of us who tend to perceive those endeavors as rather superficial. Perhaps that's a very naive and myopic way of looking at this because uh, it might be fair to say, and it's a well chronicled fact, that a lot of what and how we perceive our looks, our beauty, our bodies is so inextricably tied with what we define for ourselves as our self concepts deep within, and therefore arises either insecurity or confidence, positive or negative perceptions of ourselves. To discuss this in a lot more detail, I can't think of a better, more suitable, and more insightful individual than our guest today, who's Dr. Sangeeta Thakurani, who is an expert, sought after plastic and cosmetic surgeon. Not only has she been doing this for a number of years along the course of the many, many people whom she has helped out through various procedures, she has become a repository of human insight in terms of, what these kinds of clients and patients feel deep within when they are having these procedures done, what sort of frame of mind they come to her in, or how does it evolve and change post-op, and things of that nature. So we are calling this session of talk therapy more than skin deep. This is talk therapy brought to you by Driveway Devi. I'm Karthik on behalf of Driveway Devi, and I'm very, very grateful and privileged that Dr. Thakurani has made time and is joining us. A very, very warm welcome.
Thank you, Karthik. And the way you put the theme of this talk across couldn't have been better because I know what perception is, and being in this field, the perception that I get from my family, from others of what I do is couldn't be more erroneous. I mean, they all think I'm just into this beautifying people and doing surgeries just for the heck of it. But reality is far from it. And I hope after today's discussion, I can bring to light certain facts which are not as known about plastic surgery. And
I'm
with your
so
help.
I'm so glad your opening remarks were exactly what they were, because there is this thing, and we are of course working as hard as we can to sort of reduce and mitigate the stigma that still surrounds mental health, for example. तो ठीक उसी तरह जैसे कई बार लोग बोलते हैं, particularly of slightly older generations, की mental health डॉक्टर्स को भी पागलों का डॉक्टर कहलाया
हाँ,
जाता है. So it's sad but important to note that even people such as yourself are labeled in the same way that your patients and clients are, and that's couldn't be far from the truth, as you said.
true, very true.
We would love, before we sort of get into the topic per se, that you share with our audience in your own words a little bit about your work.
Okay. So, Karthik, as you defined, I am already a plastic surgeon. Everybody knows that. But what exactly we do, I think this is the branch which has most misconceptions and
Yes.
myths. Because, as I said, even in my family, when I opted for this branch after having done my general surgery, so this was my super specialization. So, me and my husband were trying to get a super specialization seat at the same time. My husband was trying for a neurosurgery seat, while I was trying for the plastic surgery. And the discrimination begins at home. So my husband was looked at in awe that, okay, he's going to become a neurosurgeon, he's going to save lives. And what are you going to do exactly? That was the question posed to me by my family. And honestly, I also didn't have a good idea at that time, but I knew for sure I'm not only going to be doing these cosmetic surgeries. And now, after having done my MCH and almost about 13, 14 years into practice, I can say that I am changing lives. I'm not saving them, but I'm changing them for the good, for the better. And I am so proud of the work we are doing. So, again, putting objectivity into it, we are into reconstructive surgeries. Now, reconstructive meaning whenever there is an injury to the body, a
Hmm.
body part is deformed, or there is a defect, it may arise after burn, after any accident, or maybe even cancer. So that is when we are called in to do certain procedures so that the part looks as close to normal as possible, also functions as close to normal as possible.
Right.
That is the bulk of my work. Also, children who are born with deformities like cleft lip, palate, and malaligned digits or absent digits, or sometimes even lumps and swellings and tumors anywhere on the skin. So, that is what we exactly do. We take out these tumors with minimum scar, minimum morbidity to the patient. That is what is the reconstructive part of my job. Then another part is the cosmetic part, which I really don't need to explain. Everybody knows about it, those boob jobs, those nose jobs, the hair transplant, the laser. So that is what is actually glorified and glamorized. But that is, Kartik, if I may say, like 35 to 40% of the part that we do. Rest all is reconstructive. That is how we are actually affecting, changing, impacting lives.
Absolutely, and that is precisely the detail I was seeking, and you've clarified that so beautifully. Because again, if I was to draw an analogy, मुझे कुछ खास पता नहीं है, but if I was to look at, let's say, an ophthal practice, people often assume that, oh, ये लोग तो केवल चश्मा हटवाते हैं, लेसिक करते हैं, but actually the bulk of that is very, very serious interventions for
Mm,
your diseases to do with the eyes, and particularly I think in deformities and trauma cases, the sort of procedures you're doing are life altering. So that
totally.
has to be underscored. Okay,
Yeah.
so अब हमें ये बताइए please that typically speaking,
Mm.
जो clients आपके पास आते हैं who are, let's say, not coming out of a consequence of an injury or
Yes.
trauma or an accident, who are purely coming
Elective.
for, yes,
Elective
uh,
surgeries, right.
elective surgery. What have you found over a period of time are some of the primary motivations or drivers for them to explore that?
So, Kartik, it might come as a surprise to you. Those elective surgeries, like, yes, elective surgeries are also two, reconstructive and cosmetic. Now, reconstructive elective is when there is like a swelling or a lipoma or a cyst somewhere on your body. You've been neglecting it for long, and then you want to come to us and we want to take it off and do the suturing in such a manner that there is less scar, or maybe there is a like a deviation of your thumb or digit which you obviously can function with. But at one point of time, you want to get it corrected. So that is elective surgery. It is not an emergency, but you come to us at a time of your own desire, right? So that these people definitely, one is when they want to get into a profession. For example, a lot of people in Rajasthan want to opt for these armed forces like BSF and all, CRPF. So that is where they have a very scrutiny of their body parts, and any
Hmm.
scar, any deviation, any congenital deformity is not accepted. So
I
that
see.
is one
Hmm.
bulk of patient that comes to us. Second, of course, is marriage. At a marriageable age, we see a crowd of girls coming to us for their small scars or maybe even their deformities which have been present since birth. So that is second reason. And the third, a minority is simply body image, confidence. Those patients are really less because some, even if they have some deformity, there has to be a force which actually makes them take that decision.
Hmm.
Like there are these boys who have these. Okay, so these cases mostly are males.
Hmm.
Surprisingly,
Hmm.
females are less.
Hmm.
Males are more, and a major indication of males coming to cosmetic surgery department is man boobs. So I'm doing say about 2 to 3 per week.
Wow.
And yeah, so they come to us at a time when they are getting into a profession.
Hmm.
Till the time they are studying, they are dilly-dallying.
Hmm.
And when they get into a profession where they want to really look very, sharp, and they want to wear all those kinds of attire, that is another force. And so there are timings for each set of patients to come to us. Say girls coming to us just before marriage, boys coming to us when they are getting into a profession. So there is a event in the family happening when they want to come to us.
Very insightful and very interesting. Makes so much sense. Mm, there are certain things I'm going to ask you merely for the sake of just discussing various aspects and perspectives of this whole thing and to play devil's advocate. Now, uh, there is this Purana Jumla hai, grass is always greener. On the other side, I think in a lot of situations when it comes to beauty and aesthetics and the way we
Mhm.
perceive things, also this applies where you will find certain geographies, countries, and nations who perhaps have inherently, let's say, for example, relatively small, thin, deep set eyes will find big, bold eyes very, very desirable, and vice versa.
Right.
And so, in those countries, you will find those sort of procedures happening and the
Yes.
opposite procedure happening in another country because
Yeah.
the opposite is perceived to be,
Very true.
what is beautiful. Um, I want to ask your broader opinion on this human instinct of aspiring to this largely capitalism constructed idea of beauty.
So the first example that you gave, the geographical features which are pertaining to a specific population, the other set of population is perceiving it as more trending. So this happens, and this is especially in the case of eyelids, the Asian eyelids. These Asian population, they do not have the eyelid fold, and it is a a feature that is so much sought after in these countries. Like for example, if I go and sit in some country like China and Korea, and I know how to do this double lid blepharoplasty, I can make millions. It's over there. So, and yes, we also get patients all the way from these countries only and only looking for one procedure. And yes, of late we've been getting patients from northeast of our own country also, because they want to look like one of the Indians. They feel a little uh, prejudiced against
Yeah,
when
yeah,
they
yeah.
because of their look. So this is the second most common surgery carried out all across the world, the eyelid surgery. First is liposuction. So yes, this and the concept of grass is greener on the other side. I don't know whether you call this grass as greener, or it is just a matter of belonging, because there
Hmm,
is so much movement happening across countries. We
correct.
are born in this world now. So I might want to shift to any country or emigrate. So then there is a definite desire to look like one of them. So that is one important factor.
Similarly, Doc, tell me, there is an idea of desirability that has been popularized and propagated by, let's say, the adult entertainment industry. There is this entire fantasy element to it where either women themselves or compelled by their partners are also pursuing and desiring and seeking certain
Enhancement
interventions.
surgery. Yeah. So yes, we breast augmentation is again the third most common surgery carried out all across the world. But Karthik, the reason is not what you stated. They usually come because yes, the entertainment industry, the celebrities, the choice of clothes they want to wear, they want to flaunt bikinis. So, and of course, India, the number is very low. But the adult entertainment, I am not very sure I have come across such a patient. But
Hmm.
yes, we do get males also for girth enhancement, length enhancement, females definitely for breast enhancement, breast augmentation. and G-spot enhancement. Those are the things once in a while you do get such queries.
Let's then talk about relatively more serious matter, which is really I think the essence of this conversation. And of course, without breaching any confidentiality, etc., in general terms, if you could share a few examples, because it always helps the layperson understand when things are put in a context. A
Yes.
couple of cases where it was very obvious to you that a client or a patient came to you in an extremely deficit state of confidence, and post the procedure really sort of transformed in the way he or she felt about themselves.
One example is this males with man boobs. So this person, he had appeared for the um, medical, as they call it, when they go for this BSF and
Hmm.
CRP interview.
Hmm.
So he had,
Hmm.
I think he had been turned out twice.
Hmm.
And third time, I think they only get 3 turns.
Hmm.
So this was his last turn, and he was just getting turned down because of the man boobs kind of thing. And he was trying to avoid it, by all those massages and creams and whatever was being told to him by the quacks and all. And so one fine day he lands in our OPD, and to his surprise, he was admitted, and it was his lucky day. Usually, we do not admit patient on the first visit.
Correct.
We
Correct.
give them a span of 15-20 days for
Sure.
the investigations and everything. So I don't know how did it happen. My patient, the one who was destined to come, did not come. Something like that. He was operated the next day, and he got discharged. And these are the surgeries which give you result on table. There is no recovery time. So he got rid of his man boobs just like that. And he went home. And in the next physical, he was cleared. He got a job. And I remember coming to me after 1 year with mithai ka dabbas and all those things, whatever he could do. And he was so grateful because he got the job. He was eyed. And just that hitch he had to overcome of getting a surgery. And it all went so smoothly. Those 3-4 days in the hospital. And he has such fond memories of his stay also, and yes, he is very grateful. So that is one example of one extreme. The other extreme was this girl. There was this girl from Jaipur, a low socioeconomic strata. She came to me for a nose job. She had a thick nose. She could use some correction. I did a minor correction for her because I did not want to tamper with a lot of scar and all. She was an unmarried girl. She was happy. She went home. 3-4 months later, she comes with her sister with the same kind of nose. And now the sister tells me that you did a good job for my Baji, my elder sister. You do the same job for me. So, Karthik, that was a red flag. When somebody wants a result exactly as the other patient, the doctor has to take a step back, because
No,
the
but
customer.
I'm sorry, this is going to sound terribly naive, but why is it a red flag? Why is it such a problem?
No, because then she would always be comparing her result.
Hmm.
And it was not that she was very clear about what she wanted in her nose. She just said, give me a nose like her.
Hmm.
I asked her repeatedly, you tell me what should I change in yours?
Hmm.
She said, and her nose was like very sebaceous, thick. So I said, I can slim this down. I can
Hmm.
give you a more feminine nose,
Hmm.
or give me a nose like my Baji. So I did not dig much into that then. What I later realized after, I'll tell you what happened, that her sister had got married into a good family. So that was her
So
what she
that is
had
how
in
she had
her.
associated.
Yes. She got operated once. It was okay. The post-op period was a little stormy with her showing some tantrums that chakkar aa rahe hain and this, and unrelated symptoms that ab main gir rahi hu, all those sort of things. So we associate such kind of symptoms with little hysterical thing. Okay, that went okay. Karthik, few months down the line, she comes to me again. So she says, you did not do much of a correction for me. You did a very minor thing. I want a proper rhinoplasty with a proper, sharp nose. So then I said, then you have to have a scar on the lower side of your nose. She said, okay, but it has to be sharp. It has to be, very prominent. And I also said, I'll have to take some cartilage for some grafting from some part of your body to enhance your dorsum. She said, okay, everything okay. You give me this nose. Kartik, I operated on her to the best of my ability. It was a reasonably done procedure. She was okay for a while, say 2 weeks, 3 weeks, till the time we were removing the sutures and all. And in the third or the fourth week, she comes to me and she says she was so unstable. that undo the entire thing, give me the nose which I came to you with. And Karthik, I'm getting goosebumps talking about it. It was a nightmare situation. I said, you have to wait. No, I don't like this nose. It is not as good. And I think the previous one was better. I said, what
Wow.
are you talking about? I have done so much, exercises and so much grafts and so much tissue tampering. She said, no, it's okay. I understand what you've done. But now that you've done this, you will be able to do it back. And Karthik, it was the worst 3 4 months of my life because she would come to my OPD every week, sometimes with her brother, sometimes with her mother, and they would just sit on the floor outside my room. And the mother would say, like this, she was holding her head in her hand. ये क्या कर दिया आपने? हमारी लड़की तो पागल हो गई है. We have to keep her locked in the room because she is running out and she is just throwing tantrums. She's crying. And Karthik, I called a few of my colleagues, plastic surgeons across Jaipur. I requested them that I'm going to send you a patient. Just look at her, tell
Hmm.
me what can be done. Don't charge her any money.
Hmm. Hmm.
Favor to me. And they were obviously we are friends. She went to just a couple of them. They all told her, your nose is pretty okay. You give it time to settle, and it will come to the shape that you are looking at. And don't ask about these another surgery and all. So okay, she comes from them, okay, and then again in a week she again has this meltdown. So Karthik, this is where the mental health and psychiatric evaluation scene comes in. She was a red flag. I should have gotten her assessed by a psychiatrist, but she came to me with so much faith that okay, this is my sister. She says so good things about you, and then I sent her to a psychiatrist. The psychiatry OPD is just next door to me. And there was a godsend person over there in that OPD on that day. Usually the OPD is very crowded.
Hmm.
So the
Hmm.
treatment is also 10 minutes, 15 minutes. But this chap, he took his own sweet time. He assessed that girl and he took the entire history and he then gave me we all know it was a body dysmorphic disorder, a condition where her symptoms are out of proportion to her findings.
Correct, correct.
So, but then he gave her proper treatment. He counseled her that don't tamper with your body so much, and he gave us certain medications. Then I said, okay, now can you wait for a while before we come back to your surgeries and all? She kind of agreed. So that was the day I saw her, and it's been 2 years hence. She is recovering well. I think that was the diagnosis. I should have gotten her assessed. But anyway, nose is good. She's happy as of now. But that was a situation where, all this conversation really, really looks so worthwhile to me that not all, but yes, this specific section of patients who come desiring features like a celebrity, like their sibling, or like anyone, are actually patients to be assessed in greater depth than we do.
That's a very, very critical point. Having said that, of course, I mean, I personally, as a mental health advocate, I can say that neither was it, your job, your responsibility, or your expertise to, send her. आपने उसके बाद, when you realize, as soon as you realize, rather, you did send her. So, which is great. Um, and so, towards our conclusion, I think it's important, and please correct me if I'm wrong, to also reiterate to the audience that in many instances, when these procedures and surgeries are being sought, they are purely for practical reasons also. Like the way you said, for a certain job, etc., for certain careers. So it isn't necessarily and only about vanity.
Yes.
The other thing, though, which I want to sort of conclude on, is a slightly, again, more philosophical note, where there is this entire thing of each individual is beautiful. God created us in his own image. Even we've even had very big sort of pop culture icons write and produce content to this regard. If you take a song like Beautiful by Christina Aguilera, so it calls to question this whole thing of, okay, fine, on the one hand, one can intellectually appreciate and emotionally appreciate several reasons why people seek certain augmentation, but then at some level, shouldn't we just let our bodies be the way God made them?
I differ from you here. Not just because I'm a plastic surgeon, just because I have that innate desire to look presentable, which is common to all of us. And it's I shouldn't even be blaming social media. Well, there is a Snapchat dysmorphia. It's a syndrome where all of us want to look good without the filters, and that is why we seek treatment. But even apart from that, if there is something which can be corrected, like suppose if I have a big mole sitting on my face, and every time I look at myself in the mirror, that is drawing all my attention. Why not? Why can't I go and, I mean, why shouldn't I go and get it removed?
Right.
It's okay. God has made me with that mole. Probably God wanted me to live with it. But now that it is taking all my energy and it's just sitting there and taking all my focus also. So
Right.
why
And not just yours because and you've brought up a wonderful example. I'm sorry I'm interrupting, because one has been through this, right? One has seen instances and cases through school and college जहाँ बच्चे क्लासमेट्स वो लोग पीछे पड़ जाते हैं वो उस एक फीचर के, एंड वो आपकी आइडेंटिटी बन जाती है एंड ऑल दैट.
yes. And I'm from a prominent school in Jaipur, but I have no qualms about admitting that my friends don't come to me for any aesthetic treatment. Not because they are going anywhere else, just because they don't want to get treatment. And no matter how many times we meet, we talk about simple things like Botox, fillers. They have reservations. And I really don't understand what is the reservation, but it's okay. It's totally their own choice.
Yeah.
But I have seen patients from low socioeconomic strata come to me for nose job, like I told you, for double chins, for ear shaping. So those are the people. They are not different from us. In fact, they are not even as much exposed to all
Hmm.
this what we are, but still they
बिल्कुल.
are conscious and they
Yeah.
think it can improve and they want to get it improved. But we have some biases. So these are the biases which are holding us. So I think aesthetic surgery is not it's not black or white. There is a gray.
Yeah.
You should get it done to an extent where
Yeah.
it is your personality, brings out the best in you, makes you confident. But there has to be a line. You shouldn't cross it at the expense of your body, your physical and your mental well-being. But yes, we should all have that grooming. It's a part of grooming now, not just hair dyeing and facial.
Correct.
Botox,
Correct. Quite right.
we groom. So
Absolutely, absolutely. I mean, I think you've put it so appropriately and eloquently. And of course, I mean, these things, it depends from case to case. Uh, किस किस कारण से, किस हद तक, कहाँ, क्या, कैसे, all of these factors come into play. But I completely take your point about being and the importance of being presentable, the impact it has on one's own,
yes,
feeling of confidence and feeling of goodness, really, and
yes.
well-being. So yeah, wonderful. That was a really, really insightful, interesting, important discussion. Things that don't often get discussed because, again, tragically, they are seen to begin with only as अरे अरे ये तो क्या है तो fluff है, whatever.
It's there for a good section of a society, these kind of treatments.
Yeah.
But ask me, I've seen them change lives.
Absolutely, absolutely. Well, thank you so much. We are very, very grateful for the work that you do and for the time you took out to be with us. All the very best and take care.
My pleasure, my pleasure.
Beneath the starlit sky, our love's secret line, like leaves we soar so high. Beneath the moonlight, soft touch your hand in mine, gets me every time.